Hello, welcome to my continuing video blog. Today marks the 2-month stage since my operation. I had my operation exactly 2 months ago, and I'm going to speak to you about how I'm getting on. You can see that I'm still wearing my elastics. I'm still on a soft food diet and no chewing, and I'll be on that until at least next week. That's when I go and see the orthodontist again, and she'll tell me what's the story. So elastics is one thing. Another thing is I'm not sure if I'm swollen or not. My cheeks feel quite sort of more prominent or fatter than before. I don't know if that's swelling or if this is my permanent new look. So I'm curious about that, but it's not something I'm worried about, and generally I'm quite happy with the end result. I'm fine with how I look. As far as I'm concerned, the jaw is fixed, and I still look okay, so I don't really mind. And what else? I still have, this is all still numb here, and certainly on the lower lip, and that means I'm still shaving is really slow, because I'm really careful, because I can't really feel there. And also eating food, I wouldn't eat food without a serviette, a napkin, because if there's food on my lip I cannot feel it, so every time I eat I always clean my lip. I'm a bit conscious to have food all over my mouth. It'd be a bit disgusting for my fellow diners. There's been no real change in the numbness, so it hasn't gotten better. It's still as numb as it was beforehand. I started work 2.5 weeks ago. I started work 6.5 weeks after the operation, and I was a bit wary when I was starting, because I'm a secondary school teacher. I teach English language to foreign students, so I wanted my speech to be absolutely clear. And since starting work, I feel I'm fine. I'm not 100% fine, and I still confuse the students because there are some things that I have difficulty pronouncing. Just some words, because I don't have the same range and movement in my mouth as I normally would. I think part of that is down to numbness, and the other part is down to wearing these elastics. So sometimes I confuse the students, but not that often, and they're okay. They're not being that negatively affected. So next up, so it's fine. I'm working. I'm not enjoying my food that much because I can't chew it. But generally, I'm pretty grand. Next up, I go and see the orthodontist and the surgeon for a checkup in 1 week's time. The orthodontist for the teeth, I'm hoping she'll tell me that I can start chewing. The surgeon, he wants just a checkup as well, and also he wants to take me to a laryngologist to check that my sinuses are okay. But I think they're okay, but hopefully everything will be confirmed. And I'm really concentrating now on gaining weight. When I weighed myself after about the 6-week mark, when I went home to Ireland after the operation, and after 6 weeks, or 6 weeks after the operation, I was down 4 kilos, and I still am down 4 kilos. So I want to gain that. It's sort of a bit weird. I feel like my face is either swollen or just a bit fat, but certainly the rest of me is like a skeleton. So I need to gain a bit of weight and get a bit of food into me. So that's about it. I'll talk to you again probably in a month's time, and we'll see how we are. But until then, you can see obviously my face, and you can see me talking like this. Obviously you can see it, I can't, and the other way around as well. And that's about it. Any questions, let me know. Bye bye.